Hello, friends. Today I want to continue with my series on understanding eating disorders. I want you to consider if perhaps that healthy diet could be classified as an eating disorder. In order to do that, we actually have to recognize the different types of eating disorders and their characteristics and symptoms. Unfortunately, many eating disorders are underrecognized and even dangerously reinforced in today's culture. Actually, marketing preys upon people's insecurities, worships thinness, and portrays unattainable beauty standards. This cuts down people's self-esteem, and health marketers and influencers can capitalize on these memes and manipulatively reinforce their protocols and restrictive nutritional practices. And this may be with the best of intentions, because perhaps they believe the diet culture means that to be healthy, you have to look a certain way. And I've done past videos and articles on why that isn't necessarily true. So what's happening in our culture is, rather than people receiving the intervention and care they need at the start of a disordered dietary pattern, which is a heck of a lot easier to intervene at the beginning than when it starts to pick up momentum, the experts that they're going to be healthy may actually be applauding and promoting even more restrictive eating practices in order to help their, say, for example, irritable bowel symptoms. My concern is that these popularized approaches to nutrition, to health, to fitness, if we're not careful, we could be perpetuating health anxiety, false anxiety, and eating disorders. So let's continue on this discussion of diet and wellness culture, food addiction, and eating disorders. Now, if you missed any of my previous posts, make sure that you look in the video description or on my YouTube channel or on my website in the naturopathic blog section for past articles. But for ease, I will also provide the link to this accompanying article to this video, which will also lead you to the previous articles and videos. All right, so just to kind of recap a little, in the first video in the series, I provided an overview and some statistics of eating disorders. Then what I did is I reviewed specific risk factors and characteristics of eating disorders. So we went through brain health issues, biological and genetic factors, as well as psychological and social factors that are linked to an increased risk of eating disordered behavior. I'm hoping now to, for the remainder of the series, go through the specific types and their characteristics and symptoms of eating disorders, so that perhaps on the review, you or someone you know, if you recognize these characteristics, can lead them to help. And the first step is awareness, right? So I want to provide that education. And I'm hoping that if you do kind of see yourself or someone else in some of these characteristics, you get the help that you need without hesitation. All right, so first, let me just kind of go through why I've really been paying attention to this the past couple of years, right? Especially with the world health issues and events that have been going on. People have been under a lot of stress. And a recent article from Johns Hopkins University caught my attention that actually explored this and summarized my concerns in a very succinct way. It stated that since the beginning of the pandemic, many members of the mental health community, including me, have become increasingly concerned about dramatic rises in eating disorder symptoms. And it's been reported both in the United States and globally. It includes excessive and dangerously compulsory behaviors to prevent weight gain, disturbance in the way in which folks are experiencing their body weight and shape, intense fear of gaining weight, and restrictive eating. The National Eating Disorder Association, NEDA, has reported increases as high as 107% in calls to their helpline at different points in the past 2 years. In 2020, in July, the International Journal of Eating Disorders published a survey of people in the United States who'd already been diagnosed with eating disorders. Their symptoms have worsened. Now, experts have been teasing apart the various factors that underlie this trend, but research is stating and pointing to that this increase in eating disorders and eating disorder related symptoms could likely be contributed to social media messages as well as the stress of the pandemic. But let me just step back there, because eating disorders aren't just simple than one or two things that would cause someone to have restrictive eating behavior or out of control eating behavior, or using eating disorder in a way that it's a coping mechanism that turns dysfunctional for them. It is a complex, multiple biological, genetic, brain, and psychological and social issue. All of these factors interact. And I also want to point out that diet and wellness culture aren't helping by contributing to some of these portrayals and fat stigma and obesity stigma. And I don't use those words in a derogatory term, but the way that they're being presented in the media as a derogatory term. And I find that prejudice, and I think that it's making people more fearful of food. So let me go through some of the general symptoms of all eating disorders so that you have an overview. And then I'm going to go through two of the most common, which are anorexia and bulimia. Okay, so generally, according to Johns Hopkins University, there's emotional symptoms and physical symptoms in the broadest of categories. Emotional symptoms can include being preoccupied with weight, food, calories, or different macronutrients, a refusal to eat certain foods, and this progresses to more restriction till a whole category is eliminated, such as no carbs, only eating certain foods because they're quote unquote safe. That can all be signs of eating disorders. Someone who feels uncomfortable around eating in front of other people because they have particular rituals or preferences, engaging in different food rituals itself. These can be signs of an eating disorder. Skipping meals or taking small portions of food at regular meals can be a sign. And then as far as physical symptoms of eating disorders, and this is where I think health influencers and healthcare really needs to pay attention, because what they're doing is, in order to treat some of these symptoms, they're actually getting more restrictive. And what might be is that the body's not getting the nutrients it needs to heal these actual conditions. So where we should be pointing to foods to eat, they're pointing that can help these conditions, they're pointing to foods to take out. So some of these physical issues are just, as an observer, the weight will go up and down. That's just what the body does with an eating disorder. People can get gastrointestinal complaints such as constipation, acid reflux, or stomach cramps. People can get menstrual irregularities, especially if there's a lot of restriction. There'll be problems with their period being on time or even missing periods. And if someone's on birth control or contraception or on hormones, this may be masked and people think everything's okay, even if their body's severely nutrient deprived because they're getting these periods. But we know on the birth control, it's not really a true period. It's actually the form of blood from the hormones being prohibited at certain times and then being reintroduced. People can have difficulty concentrating, so there can be emotional issues with the brain or mood issues, and then there'll be abnormal laboratory findings. So something like low hormone levels, low thyroid, anemia, low potassium, low white and red blood cell counts may be related to nutrient deficiencies. So again, if we're looking at it from only one perspective, that certain foods are good or bad, we might miss what our patients actually need as healthcare practitioners. And then if you're looking at these symptoms as something that you're eating is causing the problem, it might be what you're not eating is causing the problem. We really do need a balanced, diverse diet for our bodies to optimally thrive. So overall, these are some things to consider as a general view of physical and emotional symptoms for someone that may have an eating disorder. I want you to pay attention to that. And if you're struggling with food restriction, really consider diving in with an expert that is versed in eating disorders. Now let's go through the types of different eating disorders so that you can kind of recognize some more specific symptoms for various forms of them, okay? So according to Inside Out, the Institute for Eating Disorders, they went through the different DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, criteria for what constitutes an eating disorder. There's 8 categories. There's anorexia nervosa, bulimia nervosa, binge eating disorder, other specified feeding and eating disorders, which are OS-FED is the acronym, pica, rumination disorder, avoidant restrictive food intake disorder, or known as ARFID, unspecified feeding or eating disorders, which is UFED, and others. And under that category of others are muscle dysmorphia and orthorexia nervosa, which has proposed criteria but isn't yet categorized as a specific type in itself of an eating disorder. On my actual post for this accompanying video, I did list specific references that if you want to go through the minute details of the DSM-5 and look into additional symptoms, you can go ahead and click on those and dive into this deeper. But I did on my actual post and in this video, I'm going to go through some of the basics of these specific types. So if we look at anorexia nervosa, most people can kind of see when someone has an issue with anorexia nervosa because it's characterized by severe weight loss, or it's characterized by the lack of appropriate weight gain in a child and difficulty maintaining that weight for height, age, and stature. Many people have a distorted body image, and what people with anorexia generally do is they restrict the number of calories and types of food they eat. And some people actually exercise compulsively along with this restriction and purge as well through vomiting or laxatives. And then it can still be anorexia if they do all this and also binge. When your body is restricted and it's craving food, the more you restrict, the more the biochemistry takes over for survival mechanisms, and someone will overeat. That's why restrictive dieting always fails and people end up, quote unquote, being bad or eating more. Their body has been starving, and it's just a survival instinct that is really hard to overcome with willpower. Biochemistry trumps willpower every time. In order for someone to be diagnosed with anorexia, the National Eating Disorder Association, NEDA, actually says that there has to be 3 different things: restriction of energy intake relative to the requirements, leading to low body weight, intense fear of gaining weight or becoming fat, even though they're underweight, and disturbance in the way that one's body weight or shape is experienced. They denial the seriousness of their current low body weight as well. So even if these are not met, there's actually a subtype of anorexia called atypical anorexia. And that includes individuals who meet those criteria, but they don't meet the criteria for being underweight, even if they've had significant weight loss. So research studies have found have not found a difference in the medical and psychological impacts of anorexia and atypical anorexia. So here we go with the stigma in healthcare of body sizes. What someone who is completely obese, but the one who's underweight, who's doing those same exact behaviors, will be put into hospitalization and get help. The one who's doing the same exact behaviors but has a larger body size will be praised for these restrictive actions because they don't have a small body. But if we look at the side effects of having atypical anorexia, here's some of the statistics why this is serious. And this is why body size does not equal health. People with atypical anorexia actually have hospitalizations that comprise nearly 1/3 of inpatient eating disorder treatment. 1 in 4 adults with atypical anorexia will have slower than needed heart rate. 1 in 3 adolescents with atypical anorexia will have absent periods. At least 40% of those struggling with atypical anorexia will eventually require admission to a hospital for various reasons. And research indicates that psychological distress related to eating and body image is worse in atypical anorexia than anorexia nervosa. Okay, so anytime that somebody is excessively fearful of body weight and restricting calories, we need to think of this category and refer to a psychologist who can make that diagnosis so that they can get help. Now, bulimia is another serious, potentially life-threatening eating disorder. And it's characterized by a cycle of binging and then compensatory behavior. And that can be anything such as vomiting or overexercising. So according to the DSM-5, the official diagnostic criteria for bulimia is recurrent episodes of binge eating, which is characterized by eating in a discrete period of time, an amount of food that is definitely larger than most people would eat during a similar period and under similar circumstances, and a sense of lack of control as they're doing it during the episode. They will also have recurrent inappropriate compensatory behavior in order to prevent weight gain, such as vomiting, laxatives, diuretic, or other medical intervention use, such as fasting or excessive exercise. The binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months to be diagnosed with bulimia. Self-evaluation is unduly influenced by body shape and weight, and the disturbance does not occur exclusively during episodes of anorexia nervosa. So in other words, they don't meet the criteria of a binge from complete restriction from anorexia nervosa. It's occurring outside of that. Okay, so they're not necessarily restricting and having problems with maintaining their weight. Some of the warning signs and symptoms can be found at the NEDA website, but I think you have a good view of, in general, what to look for if someone is heading down the road of an eating disorder, and what these two broad categories with high percentages of eating disorders are. I'm going to go through more later on, especially one that is really picking up as far as prevalence, which is the orthorexia, or the excessive concern for eating healthy to the point where it disturbs somebody's social life and functioning. So I just want you all to have compassion for yourself and for others, because it's really hard right now to get true clarity in anything related to food, much less what is truly nourishing, because our society and even our healthcare system has normalized dieting, restriction, and rules around eating is the answer to a lot of issues, especially if someone is in a larger body. But it's not healthy to worry about weight excessively and to restrict yourself of vital nutrients. Just because it's normal that everyone is dieting doesn't mean it's optimal for health. So I'm hoping that by listing out the symptoms of disordered eating patterns in these mental health categories in black and white on my website and stating them to you, it's going to be a wake-up call. Because we need to offer more education on these so that people recognize them. And we need to also provide some of the statistics that are somewhat scary so people do something about them. And then we need health professionals to start widening their lens of what is truly healthy and embrace holistic wellness in areas of all various forms in someone's life. We need to stop excessively focusing and preaching just on dietary and fitness plans. There's so much more to health and wellness than that. Now, integrative doctors, people that are wise to this health at every size approach or intuitive eating or anti-diet, can also provide additional support on the biological, physiological, neurological, and psychosocial levels in one seeking help as they're getting the appropriate psychiatric or psychological intervention that they need with an eating disorder. So it's a large order to combat eating disorders, but it's necessary, and I think it is doable. Just have to all have more awareness. And I think that awareness is actually getting out there. So I hope this is helpful. And please do comment. I'd love to hear your videos. Now, at the time that you're watching this, I'm locked out of my Facebook, which is a pretty active Facebook community. I'm hoping to get back in, but who knows? So please make sure that you do have ways to actually chat with me outside of some of the social media. And the best way to do that is to go ahead and subscribe to my wellness blog. And you will also find a bunch of resources on my resource list that I will provide in the link to the video or on my website page if you're reading this article. And it will offer you all the classes that I provide for both free and as well as educational opportunities for the consumer and for the professional that offers even CEU credits, continuing education units. So I hope to hear from you soon. I hope that you will go ahead and stay connected with me in various ways because I love to be active and chat with you all. It's one of my favorite parts of doing this. And I hope to see you real soon. And please remember, be kind to yourself and others. We're all doing the best we can right now. It's a pretty stressful world. All right, take good care.